The government shutdown continues to impact the healthcare system, and we need to talk about it. We tap in on a quick update for the ECAPS bill and explore what's coming down the pipeline for pharmacy for the rest of the year. That's some of what we're talking about on today's RX Report, where you get your health, your news delivered. I'm your host, Manuel, coming to you from the home of pharmacy here at the American Pharmacists Association in Washington, D.C. Now, we've got a lot to talk about today, so be sure to click that like and subscribe button, leave a comment to join the conversation, and let's dive in. The government shutdown has lasted for over a month, and the effects are still being grappled with. A lapse in federal funding has forced many agencies to pare back non-essential work and furlough some staff, while trying to keep core public health services still running. That mix of continued critical operations plus curtailed activities is creating new headaches for pharmacists on the front lines and for patients who rely on federally supported programs. Medicare and Medicaid payments themselves continue to flow for the time being, but operational guidance and temporary program extensions that pharmacies and providers use can change quickly during a shutdown. CMS has issued rolling guidance about claims, holds, and processing, asking Medicare administrative contractors to reprocess certain held claims and updating providers as the situation evolves. To get more context on this, we spoke to Doug Hyunh, APHA's Director of Congressional Affairs. Doug Hyunh, Director of Congressional Affairs here at APHA. Thanks for being on the show. Love to have you.
Thanks for having me, Mason.
So we are in the middle, possibly tail end of the government shutdown, and it is the record longest shutdown in American history. Can you tell us how that's affecting us right now and APHA's members?
Sure, Mason, and of course you mentioned it. It is literally the longest shutdown in government history, and as we speak right now, it's Tuesday, and we're hoping to have a vote in the House on Wednesday. So hopefully this is over soon. There's a lot of different facets to this situation. I think on the surface, one of the things that people don't realize is that even during the government shutdown, Congress wasn't technically working, but folks on the Hill were still there, so we're still meeting with folks, with staffers. There actually have been opportunities where we actually met with a handful of members of Congress during the shutdown, but we're still doing our part and doing our due diligence and talking about issues such as ECAPS, talking about the TRICARE issue, addressing Senator Grassley's request for an RFI, among other things. So at the end of the day, even though it seems that there hasn't been a lot going on, we're still doing what we need to be doing, and our boots have still been on the ground on the Hill.
So even though the government is shut down, that hasn't stopped you from being able to advocate for the pharmacist profession. You're able to still talk to people on the Hill and hopefully get these actions done, or
Correct.
At the very least, like in the works.
Exactly. I mean, one concrete example of that is we talked about ECAPS, and obviously everybody understands what that bill entails. Even during the shutdown, we were still able to garner co-sponsors in the House and both the Senate side. I don't know how that works logistically, but a lot of folks did sign on during the shutdown and continue to do so. So yeah, we've still been doing our part.
So let's talk about ECAPS for a second. So that's the equitable care bill that you and others like you have been trying to push through the Hill in order to get pharmacists. Give pharmacists the ability to expand their care to a wider audience while also getting reimbursed through Medicare Part B. Mm-hmm. What really is the update with that now, especially with the shutdown happening? Where do we stand with that?
So one of the things that we were looking to do, and we may have mentioned this in the previous podcast, is that we were looking to basically try to follow what Congress considers regular order. So that's especially true on the House side, and more so than the Senate side. So what we're looking to do, and as you know, we've talked about this in the past before, it's very rare for a bill to pass as a standalone bill. So what you're looking for is a vehicle, right? So One of the vehicles that we were looking for is potentially something in the end of the year package, a healthcare bill at the end of the year package, or some type of stimulus bill. And one of the things that they were looking to do is that they wanted to make sure that we follow what's considered regular order, so that it didn't just all of a sudden airdrop per se in end of the year. And so one of the steps to basically make that happen was to come up with either a markup or some type of hearing on ECAPS, so that they can essentially make that path a lot smoother. One of the things that we were doing prior to the shutdown was we were in the process of basically putting together a hearing, and in turn, once we had that hearing, basically go to a markup. During the shutdown, we actually had a hearing in place on a couple of different occasions, but obviously because the government was shut down, that's actually one of the things that they couldn't do is even though we're still meeting with staff and we're still meeting with members of Congress, we couldn't officially have that hearing. And so, as I mentioned to you before, it got punted a couple of times, and I'm happy to say that as we stand right now, we're on track to have that hearing next week.
Great.
Once we basically have that hearing, I think it's going to potentially move to a markup. Once we have that markup, then it basically kind of opens the door for us to kind of check out those boxes when it comes to regular order, and potentially have that move forward in some type of end-of-the-year package.
So you're talking about this being part of the end-of-the-year package. Is that basically what we can hope to expect for the remainder of this year? Like, what kind of updates can you give me for what we can expect for the last month and a half of this year in terms of pharmacy advocacy?
I think that if we're able to have this hearing, that includes ECAPs. And again, I just want to emphasize the fact that it's not an ECAPs only hearing. It's basically a hearing that talks about like chronic care and basically just trying to demonstrate how pharmacists are involved in chronic care management. If we were able to have that hearing and then potentially a markup, as I mentioned to you before, I think there's a decent chance that ECAPs is incorporated in some type of end-of-the-year package, namely because of the folks that are behind the bill. As you know, of course, on the Senate side, you have Senator Thune, who, of course, is the majority leader. So I think there's a lot of momentum with that. So I think that there's a potential to have ECAPs incorporated in some type of end-of-the-year package if everything goes according to plan. You talk about PBM reform. I think that's less likely to be included. Again, it's one of those things where with PBM reform, obviously you have a lot of bicameral, you have a lot of bipartisan support, but I think at the end of the day, we're just kind of running out of time in terms of looking at offsets and basically just trying to figure out how exactly both the Senate and the House want to put together that package. We've been hearing that at the very best, what they might do is incorporate some of the provisions that were in the reconciliation bill at the end of last year that were basically including PBM reform. So I think that there's a small potential that something gets included, but I think as it stands right now, I don't see a lot of momentum behind that, just because we're just kind of running out of legislative days. Today is the 11th, and I think when I checked the calendar this morning, there were literally less than 15 or 16 legislative days left in the session. And so we're basically kind of running out of time. So I think that you might see some larger reform efforts, but in regards to some of the things that are germane to APhA and pharmacy, I think that actually at this point right now, I think ECAP stands a better chance of being included in some type of end-of-the-year package than PBM reform might.
And that makes sense because, like you said, this is one of the few things that actually has bipartisan support, something that's really unheard of right now. So if we have that sort of momentum behind it and we have people like you pushing it, I mean, it may not get passed this year, but at the very least, you're building that momentum. You're hopefully getting it tacked onto the end-of-year package, and then we can see the effects at the beginning of next year.
Exactly. Yeah, we talked about that before. I think that's a very good possibility that if it doesn't get done this year, they're not going to ignore this subject. I mean, there's just way too much support. There's a lot of public pressure, obviously, behind trying to get something done with PBM reforms. I think the worst case scenario is that we don't get something done this year, and again, it's more likely than not that nothing gets done. I think that there's a very good chance that you see some type of reform efforts in the first quarter of 2026.
All right, Doug Hyunh, thank you for being on RX Report. We loved having you.
Sure. Thank you.
On the ground, pharmacists are already seeing strains in some settings. Advocacy groups and local reports describe instances where installations or clinics couldn't fill specific prescriptions because of operational disruptions tied to the shutdown, a pattern that raises concerns about localized shortages or substitutions that force pharmacists to scramble for alternatives. Seniors, people on fixed incomes, veterans, and patients receiving complex chronic care are particularly vulnerable. Loss of telehealth waivers can force in-person visits that are difficult for homebound patients. Veterans and military families may face interruptions at facility pharmacies, and any delays in drug approvals or inspections can ripple into availabilities for patients who need newer therapies. We'll get to our next story in a second, but first, registration for APHA's annual meeting is officially open. As the biggest event in pharmacy, it is the place to be to upgrade your practice. And guess what? You're invited. Don't miss the world's leading pharmacy event where you'll shape the profession, network with leading experts in the field, and explore new innovations in the practice. Register today for early bird pricing at aphameeting.pharmacist.com. Again, that's aphameeting.pharmacist.com. See you there. Economists warn that a prolonged shutdown has broad economic effects that ultimately impact patient access. Lost federal income and reduced consumer spending can compound hardships for patients and strain community health resources. That macro pressure can, in months, translate into a lack of community support and tougher access for vulnerable patients. In short, pharmacists are keeping the patient care moving, But the shutdown is adding paperwork, delays, and the risk of localized access problems, especially for seniors and patients who depend on government-enabled health programs like telehealth. Until further notice, pharmacists are continuing to stay informed through CMS, FDA, and VA notices, coordinating proactively with patients and suppliers while collectively waiting for policy relief. Have you been affected by your ability or lack thereof to provide patient care as a result of the shutdown? Let me know in those comments. And that is our show. Thanks to our special guest, Doug Hyunh, and you, our special listener, for tuning in. How has this shutdown affected you? Be sure to leave a comment and maybe hit that like and subscribe button while you're there to let us know how you felt about the show. Today's executive producer is new, Miss Val Stevenson. Today's editor is also new, Miss Michelle Powell. And until next time, I've been your host, Mason Manuel. Same old there. Be sure to tune in next Friday for more RX Report, where you get your healthier news delivered. But till then, bye y'all.